Hi, my name is Paul Bruns, and I'm going to try to explain to you what is cancer and why does cancer suck so much. First, I want to apologize if I am offending you with the title, but I think if ever there is a time to use strong language when you're talking about cancer, it's one of those times. So, your body is made up of cells, right? You know this. Your body is made up of trillions of cells, all different kinds of cells. You have cells, they get together, they form tissues, those tissues get to form organs. Like you have cardiac cells, they all kind of act together. They get together and they form your heart. You have cells that form together and make up your bones. You have cells that make up your brain. Those are all fixed cells. You also have cells that kind of float freely in your body. You have red blood cells. Those are kind of the taxi cabs going throughout your body. They take oxygen to where it needs to go, take carbon dioxide back up to your lungs, and you breathe it out. Those are red blood cells. You also have white blood cells. White blood cells are called leukocytes. Leuc for white, cyte for cell. Leukocytes, your white blood cells. These, you might know, these are your body's defenders against attackers. You get a cut. Bacteria wants to come in, and hey, it's warm, it's wet. We have nutrients, we have sugar in here. The bacteria wants to have a party. Hopefully, your leukocytes, your white blood cells, recognize that bacteria shouldn't be in your bloodstream, and they recognize that as foreign. They come and attack the bacteria, hopefully, and make you better. So cells. Your body is made up of all different kinds of cells. Your cells have life cycles, meaning some cells live a long time, some cells live a short time. Like for instance, the cells that make up your spinal cord live a very, very long time. They don't really replicate, they don't really divide. So if you were to get a spinal cord injury, unfortunately, that's probably permanent. Other cells, like your leukocytes, like your white blood cells, divide fairly frequently. And all cells throughout your body have different life cycles, how long they're supposed to last. So how long do cells in your bodies last? Again, it depends, but let's just say that they last as long as necessary. And then when your body needs them to replicate themselves, they send chemical signals, and your cells replicate themselves. They divide in half, and there was one, and now there's two. It's kind of like an automobile. You have an accelerator, and you have a brake, metaphorically speaking. So lets up off the brake, pushes down the accelerator, the cell divides, and there was one cell, and now there's two cells. Cancer, why it's so difficult and so challenging, is cancer is your own cell, but for whatever reason, it thinks that it needs to divide more often than it really does need to divide. So just constantly the metaphorical brake is lifted up and the accelerator is pushed down. So you don't need an extra cell, but the cancer cell thinks that you need an extra cell, so it divides itself. Alright, so what causes your cells to want to divide uncontrollably? Well, it could be a lot of things. It could be smoking. That can mess with the DNA of the cells and make it want to do that. Could be some viruses cause some cancers. Could be asbestos. Could be too much UV light. You're out in the sun too much. It could just be hereditary, and your genes are just prone to want to do that. Unfortunately, so that's cancer. I'll show you a little bit. Let's say these are all lung cells. All lung cells. They're all normal, except this one. This one right here thinks that it needs to divide. So one becomes two. Now the second one is almost exactly the same as the first one. Technically it might have some slight DNA mutations, but odds are it is also going to want to divide uncontrollably. So you have two, and now two becomes four. And 4 becomes 8, becomes 16, becomes 32, 64, 128, 256, boom, boom, boom. And now you have a tumor. Okay, so let's say this is a lung cell, or a tumor from lung cells. Here's person drawn terribly. Here's the person's lung. Let's say here's where the tumor is. Well, what can happen next? A little piece of this tumor, so a group of cells, can float away, get knocked off for whatever reason, and lands over here. And they start dividing. And let's say it can come up here, divides up here. So you have a group of tumors. This is called metastasis, where it leaves one space and goes to another space and just starts dividing there. So where in the lungs, it can come down. Let's say it goes down to the small intestine or the large intestine, wherever. It goes somewhere, and it creates another mass, another tumor there. So you can have lung cells that are now here in your intestines that are growing. So again, that's metastasis. And this is what makes cancer so difficult, because they're your own cells. Right? Your body is very good about knowing what is self versus non-self, what is you versus what is foreign. Like, for instance, let's say, let's erase this. We have your lung cells. Let's say, again, you get a cut, right? Bacteria come in, and you get a bacteria here in your blood, for instance. Now, bacteria, not all bacteria, but a lot of bacteria have stuff in it called peptidoglycan, right? It's not important that you understand that, but what's important is that you understand bacteria have things that we don't have, right? So bacteria has the peptidoglycan, for instance. So you get in your leukocytes, your white blood cells, cannot mobilize quickly enough, can't get the bacteria, so you take an antibiotic. Right? And the antibiotic you take just happens to target this stuff called peptidoglycan that is in this type of bacteria. So you take the antibiotic, think of it like a million keys, million tiny keys just floating around your blood looking for a lock to open. Right? So you take the antibiotic, it comes in, it sees your cell. It doesn't have peptidoglycan in it, so it goes on, nope, nothing. Oh, there we go. It unlocks this one and destroys it. Right? So maybe now it's starting to sink in how this is so difficult. Right? Because we can give drugs that destroy this bacteria. Now, bacteria have their own problems. They can mutate. But it's relatively easy to get bacteria as opposed to cancer cells. Right? Because, again, I can't stress this enough, cancer is your own cells. It's you. So let's say let's go back to this cancer cell, and there's a tumor, okay? Now all these cancer cells, how do you give a drug that leaves this alone, leaves this alone, leaves this alone, but gets all these? And that's the challenge. One thing that they've done, one class of chemotherapy, chemo meaning chemical, so drugs, chemical therapy, drugs that you get, just kills all fast dividing cells. Well, all right, so hopefully these are dividing quickly, and so the chemotherapy in this class, the drugs that you're getting, will destroy these. But what else in your body has fast dividing cells? Well, your hair follicles, for instance, have fast dividing cells in them. So if you take this particular class of drug for long enough, your hair falls out. Right? Well, what else is fast dividing cells? The leukocytes, the white blood cells, for instance, they divide quickly. So if you take this particular class of chemotherapy drugs, it wipes out your body's defenders. And now you are very susceptible to infection. You know, what used to be a minor cut and was no big deal, now becomes a very big deal. Because your body can't naturally fight it off. Because the leukocytes have been eradicated from the chemotherapy that you took to get the cancer cells, and that's the challenge. So what else can be done? Well, maybe surgery. Maybe we can just cut this out. Maybe the surgeon can go down and resect this part of the lung, for instance, or you find a lump on your breast and you can go do a lumpectomy. That might work. Hopefully, you get all of it. You don't always get all of it. What happens if there's a little bit back here? It metastasizes a little bit back here and you don't get all of it. Maybe instead of just taking the lump, you need to take the whole breast. Maybe just instead of taking part of the lung, you need to take one entire lung out. Or maybe you need to start out with a surgical procedure and then go on and do radiation to hopefully get anything that that you missed, or chemotherapy, or whatever other therapy. So it would be a combination of therapies. So again, my name is Paul Bruns. That is the very basics of how cancer works. And I want to say, if you're watching this because you've been diagnosed with cancer, maybe because someone who you know has been diagnosed with cancer, take a step back, take a deep breath. I don't know what kind of cancer you have. There are fast-growing cancers. There are slow-growing cancers. There are cancers that if you catch them early enough, you can treat them very well. So get your colonoscopy, get your mammogram and your pap smears. There are cancers that grow so slowly that they'll never really be a problem. They say these are cancers that you die with, not you die from. And really, I'm doing this to empower you. So you start from a base of knowledge, so you understand better what your treatment options are. So you can understand better what your doctors and your nurses are telling you. So you can ask better questions. And that's it. That's the very basics of cancer. Again, my name is Paul Bruns. I am a nurse. If this was helpful to you, if you know someone else who this might be helpful for, please feel free to send it to them. And if you know a nurse, please look for my children's books, My Daddy the Nurse, or My Mommy the Nurse on Amazon.com. And good luck.